Hello, everyone. My name is Solome Tibabu, and I'm the host of the Going Digital Behavioral Health Tech Conference. I'm very excited to have Dr. Helen Egger and Rebecca Egger here of Little Otter. Welcome, both of you. Why don't we get started with some introductions? Perhaps
Yeah,
Dr. Egger and then Rebecca?
great. Hi, I'm Helen Egger. I'm a child psychiatrist, I'm a research scientist, and I am co-founder with Rebecca Egger of Little Otter, which is a virtual early childhood mental health company providing care to kids 0 to 12 years old.
And I'm Rebecca Egger. I'm Helen's daughter, and I'm the CEO and co-founder of Little Otter.
Can you talk a little bit about why you each decided to co-found Little Otter?
Yeah, I'll start. So Little Otter is something that I've known has needed to exist from the time that I was born, right? Everywhere that I went with Dr. Egger, someone, the minute they found out that she was a child psychiatrist, the minute they found out about her experience, they would ask, should I worry about my kid's behavior? Is this normal? Where do I go for help? She still gets constant amounts of calls. And it was just clear that it was amazing if you knew Dr. Egger, right? And if you had her as a mom or in your family, but what about all of the families who don't know where to go for mental health care? And so there was this massive need that didn't seem like it was being addressed. And that has not changed in the 30 years that Dr. Egger has been doing this work and that I have been her daughter. And so it really felt like and we can go more into this, but with our background and expertise, it was time to come together and make a solution for families to really bridge this gap.
Absolutely. And I think that really emphasizes that Little Otter comes from my expertise, both as a child psychiatrist, as a researcher. I'm also the mom of 4 kids. So I have a lot of experience that way, but bringing together that expertise with Rebecca's expertise in technology is really where the answer is. As Rebecca said, I started in this field 30 years ago, and we knew that 20% of kids have an impairing mental health disorder and 80% don't get care, and even fewer get evidence-based care. And through my career, first at Duke and then at NYU, doing really critical research, particularly in early childhood mental health, knowing that these disorders start early and that if we can identify them early, we can really prevent a lot of suffering down the road. And so, the passion that I have is we're doing great work in academic medicine and some select clinics, but it's not really reaching beyond the walls of academia to people. People don't have access to what is top quality care. And that's why Rebecca and I came together to form Little Otter.
Excellent. Yes, it looks like a great partnership already. Dr. Egger, as the former chair of a child psychiatry program at a top medical school, what's it like to make the leap to become chief and scientific officer of a startup?
Yeah, it's, as I mentioned, I've had an amazing career in academic medicine, both in doing research. I was the developer of the first structured interview to assess mental health systems in young children, and then did some of the key epidemiology studies, and now it's translated into 10 languages, really established that young children have mental health disorders at the same rate. And that work has been really important in changing the field. I've also at Duke and at NYU led really big departments of child psychiatry where we provided great clinical care. But I also realized that if we don't try to innovate in this area, we're going to keep going at this slow rate to get these resources and services to families. And the thing is, there is such a lack of specialists in this area, particularly early childhood mental health. And one number that we talk about is 70% of the counties in the United States do not have one child psychiatrist. So we're never going to solve this problem just by training more people. Obviously, that's important. We have to do it in a smarter way, and we have to use technology. And that's why we're 100% virtual. We have to go to where families are, go to them in their homes to be able to get those services to them when they need it.
Rebecca, can you tell me a little bit about the type of care Little Otter provides as it relates to your tech delivery model, and why did you decide to focus on children ages 0 to 12 and their families?
Yeah, so the first thing is that after doing tons of user research on top of all of the work that Dr. Egger has done, my experience, like talking to customers, et cetera, talking to parents, what was very clear is that it's not only hard to figure out where to get help, it's hard to understand what kind of help you need, right? So it's actually a two-step process. And this is where Dr. Egger's experience, research, assessments really come in, because our first step is how do we quickly identify what type of care a family needs? And that's very unique for kids under the age of 12, right? You can't ask the same questions that you ask a teenager or an adult. You have to really look at their behavior, figure out how do you even get that information in a digital way, in a fun way, et cetera. So the first step of our product is really identifying the right type of care. Families right now spend so much money, so much time to try to find care. They don't meet the right person, et cetera. So that's the first. And then the second is actually delivering the right type of care for families. So we provide parent specialist training, which is very goal-based oriented training for parents and young children. And then we also provide individual therapy. We provide family therapy, and then we also do psychiatry if necessary. So it's really a blended, depending on what a family needs, we'll match them to the right care. All of our clinicians are in-house. They're all trained by Dr. Egger. They all use our care program. And we also have, supplemental tech resources, et cetera, that gets automatically matched to families. So that's the answer to the first question. The second question, and Dr. Egger can add more on this, is why did we focus on kids under the age of 12? Well, as I said, understanding what they need is very different than working with teenagers and adults. It also is actually all about the family. You cannot look at the child without looking at the relationships between them, between their siblings, between their family. So in terms of care, it's different. And in terms of tech, it's different. What we are actually building has to be specialized for this group. And the need is so large that we really wanted to spend time to provide a solution for kids under the age of 12.
Yeah, and I want to amplify that. And really our clinical model, first of all, derives from all of my both clinical and research experience. And we're using measures that I've created during my 30 years career as a research scientist. But what's really central, and Rebecca said this, is we're family focused. And what that means is when families join Little Otter, you don't join for your problem child. You join as a family. And our initial screening and triage is all the kids in your family, all the caregivers. It starts from a position that says, we know this is about family mental health and that children's mental health is dependent on their parents' mental health, on the health of the caregivers' relationships with each other and relationships with siblings. And this, I mentioned before that I have 4 children, but Little Otter also comes from my personal experience. My second child, when he was 13, became acutely psychotic. And what turned out is he has a rare illness called autoimmune encephalitis, which is a brain inflammation disease that presents with psychiatric symptoms. And first of all, I really got radicalized in a way and was like, why is it that what my child got, because I was attending at Duke and I was able to get to the people to get the best care, but why it's not okay that every child doesn't have access to that. But even more importantly, I really have lived experience as a mom in the medical system. And I have lived experience, despite the amazing care we got, of how parents often are not listened to and aren't really brought into the care. So at Little Otter, our care team, which has, these different specialists come together, our care lead, the parents and the children are key members of this team. We are a team together. And we talk about this a lot in care, but the truth is it often doesn't happen. We have very siloed care where the different practitioners don't speak to each other. They don't coordinate the care together. So what's so exciting for me, having been in this field for so long, is we are really building a care model and then a care platform that is focused on the family, is measurement based, and is fully integrated in a team-based care. And that's not only for, let's say you're coming in, you're treated for a specific anxiety disorder. We also are doing, every 3 months, we're doing what we call quarterly child and family mental health checkups, kind of like a pediatrician. So we're checking back in every 3 months and saying, how are things going? And are there new issues coming up? But it also gives us this opportunity to talk about prevention and mental health promotion. We don't want to only be focusing when there are problems. We want to be there to really enhance the mental health and the competence of children and families.
I'd love to give one example too, kind of this in the real world with one of our families, right? Is that she was talking about how she is a kid who has kind of the problem child, right? And he has, a psychiatrist, a therapist, etc. But this past year has been so hard. It's been hard on the family. It's been hard on her other 2 children. But when she went to her other son's, therapist and was like, what do I do about my kid? He's like, well, I have a 4-month wait list. Here's some other names. Good luck, right? And so even though it's affecting the family, that really is what we're trying to change. Is this is your one place, much more like a pediatrician, that says if you have other, once you're a Little Otter family, you can get care for anyone in your family. It's not just your one child.
So can you tell us a little bit more about what conditions you specifically treat?
Absolutely. So we really are treating what we think of and know are the common emotional and behavioral mental health challenges facing children. And that, as I said, is about 20% of kids have those. So depression, anxiety disorders, ADHD, behavioral challenges. Although we don't treat primary autism spectrum disorder, we do know that so many children who are on the spectrum have mental health challenges. So, 50% have an anxiety disorder, 50% have ADHD. So we can serve children with developmental or intellectual disabilities to treat the emotional and behavioral disorders that they experience.
And what about the providers on your team? Can you tell us more about them?
Yes, this is really a key part of providing quality care, and really, again, comes from my leading large departments of child mental health at Duke and at NYU. We are extremely selective in the providers who we choose. We choose about 1 to 3% of people who apply to be Little Otter providers, because they have to have training in early and elementary school mental health. They have to have training in providing evidence-based care. But more importantly, I am training all of our providers. I am supervising all of our providers. And we've created a really dynamic learning environment that's somewhat similar to academic medicine, where you have a community of providers who supervise each other, who do case conferences, who continue to learn where is the science going and how can we continually provide better care. And I think nowadays, people can feel really isolated, if either in private practice or even in some other kinds of practice experiences. And I feel like having really fulfilled providers is an essential part of really giving families the quality that they're looking for.
I would also love to add, and I think this kind of, as we think about our scalability and growth, it's very important that these providers are able to deliver high quality virtual care. So
Right.
it's also that we find people who are really
Yeah.
engaging, have really thrived in the past year at doing virtual
Yep.
care, enjoy it, see the benefits of it, right? Like being in families' homes, et cetera. And that's been one of our requirements as we've been hiring folks. It means that we've created a team that's really virtual first. It's not looking at virtual as, oh, well, I have to do my, normal job and figure out how to make it work virtually. It's really great. We have this opportunity now to reach way more families than I ever could before. And how do I actually, and they come to our product sessions, they give us feedback. That's also why having them be part of the team is so important, is that it lets us iterate very, very quickly.
Right.
Speaking of scalability and growth, why don't we pivot over to some business questions? Can you tell our audience first, are you B2B, B2C? How does somebody enter your solution?
Yeah.
Right now, we're B2C, so we're selling directly to families. We have a lot of partnerships in the community where we're getting a lot of referrals. So although we are selling directly to parents as an out-of-network provider, we really know that parents go to their pediatricians, to other providers to get help. And Dr. Egger and our advisors has been a huge influence in this and helping us integrate, on the community level where families really go and where they are.
Yeah.
Going forward, we definitely want to think about expanding with other partners, be it providers, employers, and we've started a few of those conversations. But as we've both been talking about, our number one goal is to make something that actually works for families, that doesn't feel limited by other feedback right now. We want to create an experience that we know has an impact that leads to better clinical outcomes. And that's our first priority.
And just to clarify, where can parents find you today, geography-wise?
Right now, we are available in California to any family with a kid under the age of 12 or under. And we are in the process of expanding across the US. But we're really seeing California, once again, as our first experiment to make sure that our experience and our quality of care lives up to our expectations before we grow too fast. But we know there is massive amounts of need. We've had a growing wait list. So if you are not in California, you can sign up for our wait list, and that's informing where we're going next to make sure that we bring families on as soon as possible.
In terms of investments and getting started up, can you talk a little bit about who your financial backers are and why they bet on Little Otter?
So we raised a pre-seed round about a year ago and then closed our seed round earlier this year from a group of amazing investors. I think every single day we're grateful by the team that we've put together. So Torch Capital led our round along with Vast, and we also have Canaan, Able, 8VC, and a lot of angel investors. I think the biggest thing that really made them excited about what we're doing is the growing need, that we just know there's massive amounts of need. This is an area, I like to think about it's very akin to, I would say, aging or elderly care and health. It's a group of the population that hasn't been served before, and it's prime to be targeted for really amazing solutions. There's so much need, and also they need something that's slightly different than everything else that's being sold, right? And so from just a product marketing and a partnership point of view, it's incredibly exciting. So I think that's the main reason. And the other thing, go ahead.
No, I was just saying, I think the other thing that really excited our investors is both my experience and expertise and my relationships nationally and internationally, and that I left my incredible job to do this full time, that this is where 100% of my passion and energy is going. And how do we channel the work that I've done and my incredible colleagues who we are fortunate enough to be able to bring into building Little Otter. And that's I think a differential, particularly in this early childhood realm.
So I have many more questions to ask, but perhaps if I could end on this one, what are some areas of opportunities to support families following the pandemic?
Yeah, I want Dr. Egger to answer this, but I'll just prime it by saying, I think, we've had this idea for Little Otter for a very, very long time. I think that one of the positives that have come out of this pandemic is that families and providers are more open to virtual care, and it proves that it can work. But it also has blown open how much need there is. And so it existed before, but at least it's now coming to the surface. And so I think it's really addressing those, but I'll let Dr. Egger take it from there.
Yeah, absolutely. I mean, I think that the pandemic, as Rebecca said, really demonstrated that telepsychiatry with children is not only works, but that parents in many ways prefer it, and it makes it much more accessible. There are even advantages in being in people's homes. You can, my patients can show me their favorite stuffed animal or their room. I mean, you really get to engage children and families where they are. But I think the pandemic also really, really laid bare the impact of this shared trauma, which it really has been, the pandemic, and its particular impact on families, both, of course, because of fear of illness, people who've been sick, people who've lost loved ones, and the incredible economic impact and childcare and school impact on families trying to juggle doing their jobs and taking care of their children. So as we are kind of emerging out of the pandemic, we're not returning to normal. This is a new phase of our life. And I think in particular, there are going to be huge needs that are really going to emerge even more when school starts in the fall, and when families are sort of trying to go back to what we've done before, but realizing that kids haven't been in these settings, they haven't had the opportunity to be social with other children, but also, that there's going to be a legacy that's impacted their mental health. I guess in conclusion, though, I'd also want to say we have to be fighting mental health stigma in order to be able to fulfill the vision that we all share for digital mental health. And so I think our hope is that as we are emerging from the pandemic, we can keep a focus on this conversation and really normalize it. That's why we call ourselves a pediatric mental health company, right? Just like going to your pediatrician, how can you go to trusted mental health professionals to decide, should I worry? Should I not? How do I support my child's mental health, as well as address when there are mental health challenges? And I think really importantly, that parents in particular don't feel the shame that they feel now. So many parents feel like this must be my fault. I did something wrong. And the truth is, again, these are common disorders that we can identify and we can treat. We can help children and we can help families. And so our hope going forward is that there's sort of been an opening that we want to be part of this really sea change, not only of a high quality services available in your home, but also to really bond with families, to join with them, to be partners, and to get the word out that mental health matters, that there's no health without mental health, and that we can really enter into a new era of really bringing mental health needs and care to the forefront.
And I will also, I agree with that 100%. And I think that's exactly what we're trying to do. I think it's partnering with parents, but it's also partnering with schools, with employers, with insurance companies, with health systems. how do we actually change the headwinds that have been keeping families from getting the care that they need, right? And I think we have this massive opportunity now, and we really want to figure out, how do we unlock this and change the way that it's been happening before, because it's not just going to be one person. There is so much need.
That's right.
And there is so much help that can be given. So how do we take our experience and our expertise and match it with other, people, and figure out, because we also know families do not exist in isolated systems, right? They exist within schools, and there's, parents are employers. It's a complex ecosystem, and we want to be the mental health support for that.
What a great message. I'm sure that's going to resonate with so many in our audience, not just professionals, but so many of them as parents as well. Thank you so much, Rebecca, Dr. Egger. So exciting to hear about all of the amazing work you're doing with Little Otter. Thanks for being with us.
Thank you so much.
Thank you so much for having us, and for the work that you're doing in this area.